I was just going to ask you a few questions. First of all, what method do you use for dry needling?
So there's a few different methods. The method that I use mostly is clinical dry needling, so Western acupuncture, where I'm aiming to use the needle to release a tight trigger point, which can either be active and painful, or like a latent trigger point, which is painful when you press on it. So with that method, what I do is find the trigger point that's either causing the pain or contributing to the patient's problem, and then finding the trigger point, palpate it or hold it in a way so that it's easy to have the needle sort of make contact and get to the trigger point, and then from there we can use the needle to sort of move in and out, or we can leave the needle just in the muscle. If we want to stimulate the trigger point a bit more to get a twitch response or to get more blood flow to it, then we can fan or move the needle, and then that helps it release a little bit better sometimes. So yeah, that's the main method I use. Another way of needling I use is to help with inflammation or swelling. So that's more superficial, so not going as deep, and using a few needles around an area of swelling to sort of help initiate or bring on a better immune response and help the swelling go away.
How long do you normally keep the needle in for? What can it range from and to?
So it depends on, there's different gradings of needling. So if someone hasn't had any acupuncture before and it's and you don't know how they're going to respond to it, usually you just insert the needle and take it straight back out again. So you don't want to leave it in there for too long. If someone's used to having needling and they've had quite a bit of it done before, or if you want to stimulate the muscle a little bit more, you can leave the needle in for longer. So you can leave it in for 20 to 30 seconds, or you can leave it in. Some studies suggest leaving it in for 20 minutes, but usually I just leave it in for as long as I need to feel a difference in the muscle tension and tone. And usually as soon as I see a twitch response, which is the muscle eliciting a twitch when it releases, once I've seen that, usually I take the needle out.
Okay. And what conditions do you normally use it for apart from trigger points?
A lot. So needling can be used for, on most people. There's a few instances that it's not appropriate to use needling or not safe, and obviously we go through that in our assessment by asking questions. But if it is appropriate, it can be used for pretty much any muscular condition where a tight muscle or a taut band of muscle with the trigger point is either causing pain itself or contributing to a problem. So most problems that people will come in for, any area of the body, if there's a muscle that's causing an imbalance, we can use the needling to help release that, to even things out a little bit.
And what effects do you see from dry needling?
Generally immediately. So as soon as the muscle's released or had a twitch response, usually you can see that or feel that the muscle isn't as tight, and the patient themselves report that the muscle doesn't feel as sore to press on, or feels a bit looser or has less tension in it. So as well as that immediate response, there's also generally an improvement in muscle length. So if the tight band of muscle that the trigger point was in was restricting range of motion, then releasing that, you get better range. You can also see some improvement in strength sometimes if the muscle wasn't functioning well, and then along with that you get better function as well. So generally people report that their problematic task that they were doing seems to be easier, less painful, or they feel stronger. So lots of good results.
Yeah. And do you find people get sore after?
being sore or a bit achy is one side effect of needling. Some people do report feeling sore, some people don't. So often it depends on the individual and why you've done the needling. But generally, if there is a bit of post-treatment soreness, it will only last possibly for a couple of hours up to 1 day after. And yeah, it's not really, most people will report it's not too bad to be a problem. Yeah.
And not every physiotherapist knows how to do dry needling. How do you become qualified?
So dry needling isn't included in sort of like undergrad or physiotherapy degrees. So generally it's something that you go on to do as extra learning after you've finished your physiotherapy degree. So I've done 3 dry needling courses so far. So I've done a beginner's course, an advanced upper quadrant course where you learn sort of more advanced techniques for needling muscles around sort of the shoulders and around the other areas that can be a little bit more vulnerable. And then I've also done an advanced lower limb or lower quadrant needling course where we've learned more advanced techniques specifically like around the lower back, the hip, around the foot and ankle. So had really good results with pretty much all the techniques I use quite often.
And is every physiotherapist here qualified?
Yeah, so everybody that works at Club Physio, we've all gone on and we've done training in needling. So anybody here can do needling if it's needed.
Yeah, great, thanks.
Alright, so Jess has come in today with, she's 2 weeks post a calf strain, so she has a few trigger points through the lateral or outer part of the calf here. So we're going to use some dry needling to help loosen up that area. So what we want to do is find the trigger point. So we're looking for the trigger point. Good, so there. So what we're going to do is, with that trigger point, we're going to mark where we're going to needle. Swab the area. Good. So I know where the trigger point is. And small pinprick. Good. There we go. How does that feel, Jess?
Yeah, that's fine.
Good. Alright. So I'm just going to move that a little bit. Okay, and we'll just let that sit there. Is it aching?
No.
Mm-hmm. Good. Okay. And gently coming out. Good. And pressing back on that area. How does that feel now? Does that feel as tight as before?
Yeah, it feels much better.
Better. Good. Okay. Excellent. Doesn't feel as tight either. And that's dry needling.